Hello, good evening. Good evening, good morning, as there are students from many countries. Say all the questions. I was just reading all the questions. Right? Don't worry about it. In fact, I'll be answering all of your questions, right, without asking. You don't have to ask everything regarding the notes, regarding the links, everything would be given. Right? So something which I didn't like, right? Something which I didn't like. There was some indecency. Please don't do that, because otherwise what I have to do is I have to simply block those users, right? So don't force me to do that. I really don't like it. That even if someone is writing indecent, but for after all he or she is a medical student, right? So please don't write anything indecent. Okay? All right. So here it is. That's our main purpose. That why we really decided to start this series. Yeah, I'm reading everything. Yeah, good evening, good morning. Okay, so this is absolute essential series, right? Absolute essentials. The yes. Say I'm coming to every point, right? So just listen. Within 5 minutes, you'll be getting answer of almost all your questions. Whether it is about whether there'll be a test or not, what about the links for the future, how many subjects I'll be teaching, right? Everything is over here only, right? Everything will come. So don't worry at all, right? We'll be talking about everything. Yes, namaste. All right. So here it is. We start, right? Our first session of Absolute Essential series. And whatever the things which are written over here, right? That this is for the comfortable journey to your MBBS. Yeah, actually, that's the whole idea about it. So that you are comfortable till you complete your MBBS, right? It's a long journey. Yes, I get many of the mails that yes, it's like a marathon. So surely, right? And that's the reason it is written like with you till you are MBBS. Yeah, actually, whatever is written, I mean it, right? And never feel alone. Whenever it's like you got any problem, just let me know, right? I'll be giving the email address also, so you can send a mail at that, right? It's like I get about more than 400, 500 emails a day. It takes substantial time to answer that. So in case if I'm not answering immediately, please keep patience. I'll definitely be answering in a day or two, right? So today is the first session, and that's anatomy absolute essentials, right? So today in fact, for this entire week, we'll be talking about anatomy, right? And in anatomy, what shall we be discussing? Coming to that. Here is my brief introduction, right? This is for the medical part, and that this is MBBS DMRE, diagnostic radiologist, MRI of lumbar intervertebral disc, right? And this is what I did in IT, information technology. I was technical evangelist for Novell, and Master CNE, CIP, CIBS, CIM. These are all the degrees. And then that's the name of my company, trained over now to much more, 8,000 plus medical students in several countries, and even 7,000 plus IT students. Yeah, that's my passion. This is like ultra marathon runner. I've run about few of the races. They were over 100 kilometers. I'm into photography and into this oil painting also. So there are few films which are on YouTube, my channel, for the oil painting also. You'll see my paintings over there. All right. Don't worry, I'm coming to that, right? I'm coming to that, almost all of your questions. So first I'll solve your questions, and then we'll be proceeding for our today's session, right? Now the first question, which I feel like I need to answer. That is about this series, right? That what exactly are we thinking for this series? One, say what happens that when you start MBBS, and after one or two lectures suddenly it comes like that, this is this type of joint, this is primary joint, this is secondary cartilaginous joint, and then comes certain aspects, some words, and and it is at times taken for granted that those words are known to you, right? Wait, just see whatever you are asking, just wait for 5 minutes. What I said is that you'll be getting answer of all of those, right? So just wait for 5 minutes, just listen, just listen. So about this series, right, one is that those important concepts, now these important concepts, they will be covering, yes, all the subjects, right? So whether you are in semester one, at times you might feel, if you are a senior, let's say you are in fourth or fifth semester, and then today you might feel that, okay, this is so basic. But as today also, as we'll advance, you'll see that we'll be talking about even differential diagnosis of certain disease. But with respect to that, whether you are in semester one or you are a senior one, right? Whether you are a senior, maybe if you are senior, so for you it would be like brush up of certain concepts, but there would definitely be something new for you too. So I'll take care of that, right? So anyone from any of the semester, the whole idea would be that at the end of the session you should learn something. That's the whole idea, right? So this is the first thing. Second, yeah, this would be a long series, right? Try not to miss any of the lecture. As I said, I always believe in this concept that once the foundation is good, we'll keep on building on it, right? Step by step. So from anatomy to physiology, right? And even if you are from first semester, right? Still, right? No problems. Biochem, so much so that patho, pharmac, right? Pharmac, even medicine, even I'll show you the surgical instruments, right? Radiology, CT, MRI, ultrasound. Even if you are in first semester, yes, because at any stage of life, at any stage in MBBS, you are bound to study that. So why not to study it in such a way that by the time when you actually start learning those topics, those subjects, right, you'll be so comfortable, right, that your learning curve will become easy. You'll be able to learn the things much faster, right? uh See, friends, please, unless and until in comments, because otherwise what would happen, I would be forced to stop the chat, right? I really don't want that. But say any of the personal thing, right, any of those congratulation, etc., don't do that thing over here. Don't do that thing, because one, it will be distraction for others. And as we can see that when there are more than 350 people when they are studying, so at least start respecting others and don't distract others, right? So don't force me. No need to write that from where are you. Just it is like one single thing. It is like a one-to-one lecture, right? In case if you have got any problem, as I said, just wait, listen. I'm about to tell you each and everything. So stop writing. No need to write all these things, because the moment you will do it again, my intention is that yes, it has to be a long series so that your entire concept, anatomy, physiology, patho, pharmac, gynec, obstetric, pediatrics, everything is going to take. So unless and until there is a proper discipline, right, I would be forced to stop all those things. Yes. So please, no, that's okay. Don't write sorry, but don't do it, right? So now I don't wish to take the name, but please stop this, right? No need to introduce yourself from where are you. Please Don't do that. And please don't force me to repeat that thing again and again. Okay? Thank you. Okay. So coming back to the second point, say I was getting few mails about the timings part, right? Friends, it is like, say timings, it would be difficult to change the timing. Why I have kept it 7:30? Because see, students from so many countries, they'll be sick, still they are adding up, right? So many countries, they are coming over here. So 7:30 evening, this is the time which you have to adjust, right? In case if there is any plus minus, that all these things, they will always be available on the YouTube in the form of recorded part, right? So that is always available to you. Third thing, this is very important. What about the notes, right? Yes, link of notes every day. You'll be getting this PDF, right? And I'll be putting, I have already prepared a Google Drive, right? That link. And as soon as this session is complete, in the comments, right? So you don't have to even worry about it. In the comments, I'll be putting this link. Okay. So you'll, and this link is without any password. So you just click on that, you'll reach to a folder called Absolute Essentials, right? And in that, every PDF. So it's like, say, week 1, right? This is week 1. So there will be 1_anatomy, 2_anatomy, right? That way, I'll keep on putting all the PDFs. Then when we'll be going for the second week, right? The new folder will be there, but into that main folder only. So you have to follow just the same link. Though this link will be put in every at the end of every lecture, so that in case if you miss, it will always be available, right? All future lectures, they will be over here only, right? So you don't have to wait for someone, or you don't have to wait for someone's invitation that you have received the link or not. Everything is over here only, right? Another thing what I'm planning to do for today is that in the comment section, right, I'll put for this week, that is week 1, that is lecture 1, 2, 3, 4, 5. I'll create the links for all the days and I'll put it over there, right? So again, it would be for your convenience, as someone has already put, right? But still, I'm also writing it, right? For any of the problem, right? Sometimes if it's like, you can always write in chat and I'll reply to that. But still, if you wish, right, so you can mail me, so that way, right, till you are MBBS, right, at gmail.com. So as I said, that almost 450 to 500 emails are coming every day, right? So at times, because it takes substantial time to answer. So I'll not be very formal, like say, hello, how are you, right? Obviously, those things won't be possible. To the point, I'll start answering to your queries. Okay. One small request. Let's say sometimes your query is regarding some technical issue, right? When I say technical issue, it's like that I'm unable to hear properly, or I'm unable to, say, visualize the things properly. The thing is, say, when there are 400 plus people, and if 399 are getting it okay properly, right? So it means there is some problem on your side, because over here, technically speaking, currently we are on the on the speed which is over 200 Mbps. This is a very high speed for any of the streaming thing, right? So any of the technical issue, yes, you can definitely mail me, right? And I'll guide you in case if it is necessary, right? So don't worry at all about any of the. Then regarding any of the medical question, so in that, even if you'll mail me, I'll definitely answer. But what I wish is, let's say you have got some query, and today, say, we'll be talking about some specific topics, and in case you have got query, if you ask it in chat, so then who knows, this might be the query for so many other friends also. So that way everyone would be benefited, right? So use your justification that how should we really plan for it. Okay. And now the last point, test. Yes, every Saturday. Every Saturday we'll be having the test. Every Saturday. Now I call this test as honest test. Honest test. Because what test is? Test is where you evaluate yourself. You don't have to fight with someone else. है ना? So what if we conduct a test like, say, let's say there would be 50 questions, right? 50 questions. What would be the course? Whatever we studied from Monday till Friday, right? For this week, obviously, it would be Tuesday to Friday because yesterday we didn't take it. So, but normally it would be like Monday to Friday, or for this week it is Tuesday to Friday. Whatever the topic which we cover, right? That would be included into those questions. But these questions, they will be so vital that they will be covering up so many clinical aspects. Yes, don't worry, even if you are in first semester, but still I'll be explaining you everything so that it is easily digestible. The whole idea is your journey to the MBBS should be not only enjoyable, but it should be comfortable, right? So gradually you'll start feeling that things are going tougher and tougher, right? It would be like initially, your test timing, gentlemen, it would be same. As I said, it would be 7:30, right? 7:30 p.m. IST. Right? It would be same. Every day we'll be meeting at 7:30 to 9:30. But as we'll progress, you'll find that things would be becoming tougher and tougher, right? So give your heart and soul to understand the concepts and wish you all the best. And let's start with our today's session, right? Just before uh, I was reading a book and came across a very good sentence, and as I was thinking about that sentence, so I thought that definitely every day I'll keep on sharing something with you, right? So this is the sentence which I felt so good, and it is absolutely in reference to our current series, right? What the sentence was, that the only difference, right? That the only difference between, right? This is between where you are and where can you be is the steps. This is the keyword. You haven't taken yet. So this is, when I read this, I felt that yes, it is so much in reference, right? Okay, no worries. You can ask this test. None of my sessions, right? None of my sessions, they are like, I never force anyone, whether it is like offline or online. Even in any of the colleges wherever I have taken lectures or series, I never force anyone, because no one can be forced for studies or exam, right? So it's like in my class, if you come only with your real heart and soul, right? Come with pleasure, right? Study it. So it's like I'll never be forcing you that yes, you must come for the exam, but yes, definitely come once, have a taste of that exam, and you'll feel the difference, because the exam style would be completely different. Again, you are asking so much about that. What about the next exam? What about this USMLE? This, that. When I tell you, I'm not boasting. I'm not giving you any of the false hope. But trust me that once you have appeared for, let's say, 20 exams, and then you try to solve any of those next questions or USMLE questions, you will find that there is so much of similarity. So much of similarity, so many questions, so many concepts. Actually, uh, say it's like if we are discussing this for 1.5 or 2 hours, right? I try to compile the material in such a way that every semester students, they are happy. At the same time, those questions, those concepts, those cases, everything is compiled within shortest possible time. At no point of time will be going for PPT. No, everything would be handwritten. So that when I draw, when I say the way I learned, I'll be explaining it to you. Okay. So yes, there won't be, where will be the test upload? Well, as I said, wait for that day, right? On the test day, and we all will be meeting over here, and I'll let you know about the test on that day. Just come, enjoy, and you see what would really happen, right? You'll really like it. Yes, surely, the test would be uploaded. Its PDF would be uploaded here only, into that link only, so that whatever we are discussing over here will be available to you, right? Nothing. And please don't do this, right? Please don't do this. That is anyone from Vizag or this, that. Please don't do that, right? Some things I don't like, and if I don't like, I'll say point blank. So please don't do these things, right? Because it deviates the entire focus, right? And for the benefit of, when there are more than 425 people are there, so then why to do that? Okay. I'm a first year student. Will it be waste of time if I attend second year lectures? Not at all, gentlemen. Not at all. Right? You will be very happy. Even if you are, I'm telling, not first year, but even if you are in semester one day, when you will be talking about that, okay, this is artery forceps, or this is a special scalpel, right? Any day you learn it, it would be the first day. है ना? So why not to learn it early, right? You'll be far more benefited, because say when you'll be knowing, let's say when we are discussing inguinal canal, right? When we are discussing inguinal canal, and if you are knowing about it, that how to go for those reparative processes, what are the various types of mesh, it will actually make the subject more interesting. Okay. So in case if there is any clash, right? Clash, so we can always say that yes, over here, like, or everything in the form of recorded session, they will be available over here. So let's say if someone skips, someone misses that test, no worries, start the video, because initially to everything would be like a test only, right? And then we'll be going for the explanation, right? So definitely, yes, I'll be uploading all the PDFs so that there won't be any issue about it. Okay. All right, let's start with our today's topic. So as we said that this week we shall be talking about anatomy, right? Break it. Tommy to cut, is to cut. Anna means to see. So that's a simplest definition of dissection. So we dissect, we cut, and we see, right? So over here, when we say dissection, so it means at that point, it is a completely different world, right? A completely different world. It is exactly like when we are traveling to some city, we are traveling to some new place. So then if the name of the roads are not known, it becomes a problem. So this is the reason we'll be requiring a very good terminology. You should be very crisp, clean about the terminology part. Right? Some of the terminology, they are very easy, right? Though I'll be taking it, because this thing is getting recorded. So even in future, if someone from first year, right, one who has got no concept, but even if he or she starts watching it, they will be comfortable, right? Say, just waiting. See, as I said, right now, don't ask about the USMLE, etc. Right? Don't do that. Don't do that because it distracts. So either I ignore you for such questions, right? So and I don't like that. As I'm telling, I'll be taking all of your lectures from semester 1 to all the way. This entire series, it is meant for everyone from semester 1 to everyone, right? So where are the lectures for second semester or second year? No, everything is here only. Today we are starting with anatomy, but just patiently watch the whole lecture, right? And then you yourself will understand that how important it is. Okay? Yes, exactly. You are right. Right? This is true. That please, yes, those who have written this, very right. Right? Very right. That just listen and if you have any queries, just mail sir. Very right, Tushar. True. Okay. So let's start with something what we are planning for today. Now see and suddenly what it is, right? That this is IFA, yeah, International Indian Film Academy Award 2019, because 2020 was cancelled. But what are we doing it over here? What they are doing it over here? Say, as I was going on one site, right? And that site is IFAA, right? This is International Federation Federation of Association of Anatomists, right? So how closely it is, right? Over here it is IIFA, International Indian Film Academy. And this is, when you speak, they both are like IFA, right? But this site is ifaa.net. This is the site, this is the federation who is responsible for all those nomenclature, right? So as we said that these nomenclature, they play a vital role. So that's why it is terminology of anatomy, correct? But then because they are like Latin, Greek, so that's why there will be small change. It would be called as the terminologia, right? Let me use some other color. Yeah, this is okay. Terminologia, and in anatomy it is anatomica, right? So the whole thing is terminologia anatomica. Its basic meaning is terminology of anatomy, right? In other words, in short, written as TA. So from now onwards, we'll consider it as TA. While this is important because this is a global standard, right? This is a global standard. And once you go to that site, right? Not this IFA, right? Not this IFA, but this IFA, right? IFAA.net. And you will find that there is such an extensive work going just for the nomenclature, right? This is the global standard for nomenclature. Nomenclature means how the names are given to everything. And you will find that so many new names, they keep on appearing. The whole idea is that from the Latin, Greek, some of the main words will be coming. These words will be important when we'll be learning about the muscles, right? Those longus, brevis, rectus, such names. But once you understand that terminology, it becomes completely easy because just from the rectus, you'll know that this muscle is completely straight, right? Longus means it is something which is a long muscle. Brevis means you'll know that this is a short muscle, and that thing will make your understanding much easier. Please just listen, right? Everything would come. Everything, I'll answer all your questions, but not when the concepts are getting explained, right? You, as I said, that I've given you the mail address, so send a mail. Okay. All right. So this is Latin, Greek, and now even the British and the American spellings, they are now also included into this nomenclature. So it is developing. This TA, that is Terminologia Anatomica, right? Currently its second edition, it is in progress, right? Which was launched in 2011. So it means if it is about anatomy, then about what about histology? Yes, there is Terminologia, and for histology, same style, right? It would be histologica, right? So it means for histology, when you say pseudo stratified, right, then what exactly that means, etc., right? All those things, they have got definite meaning because it is designed by the global standard. So that was released way back. Some of the things, they don't change much. Say there is so much of work is going on in embryology. So again, over here it would be, say, terminologia, right? Embryology, right? So it is embryology, right? Now this was in 2017. They released that latest version. That is the second version. So that way they keep on updating everything about it. Similarly, even in neuroanatomy, it is there, right? So all the concepts, all those concepts, they will be explaining and they will be uploading at this IFA. Actual committee currently which is inactive, they are called as the FCAT, right? That is federative. C is always committee, right? Committee of Anatomical Terminology. Now sometimes I'll be giving you these details. The idea is just to know that yes, there are organizations who are working for it, right? Okay. Coming to our first part, whenever we'll be describing anything, this is what is called as the anatomical position, right? Anatomical position. Things which are crystal clear, I'll be going a bit fast. In anatomical position, say, standing straight, this, that, everything, right? Okay, so we'll just write, say, stand straight. But some points which are vital. One, that eyes should be open, mouth shut, right? Some points which can easily be missed. Then say, what about palm? Palm should be facing forward, right? So palm facing forward. And finally, those feet, they should be parallel, right? So feet, they should be parallel. Otherwise, rest of the things, they are automatically known to you, right? Regarding the shoulder, this, that, face should be straight, etc. But these are the important points. Otherwise, stand straight, and that's how the whole anatomical position, it will go. These are the planes, right? Planes. You should be crystal clear about any of those planes, and it at times it happens. So if this is the head, right? If this is the head and you put a crown, right? This is a crown. So that crown would always be side to side. So if I watch it from the top, this is where the crown would be. This would be the direction of the crown, right? So crown is, in this case, it would be this direction, correct? It would be this direction. And C, this is crown. C for C, this is coronal, right? That's what is called as the coronal plane. Right? So coronal plane will do what? It will divide the body into anterior and posterior. So if I say this is coronal plane, so here is the posterior, and let's say this is the nose, right? So, and this is the anterior. Yes, in exam, I'll definitely be asking at least one question from this, right? The question would be like that, let's say coronal divides the body into right and left, upper or lower, or anterior and posterior. Got it? So in coronal plane divides the body into anterior and posterior. Correct? Anterior and posterior. This is what is very much needed. Now say, here is another. I'm using another color. Here it is dividing like this, right? So it is doing what? Whatever this plane is, it is dividing the body into right side and the left side, right? So when it is dividing it like this, so I'll call this plane as sagittal plane, correct? So sagittal plane. So and sagittal plane would divide the body, right? It will divide the body into right side and the left side. So this is right and that is the left side. Done. So these two planes are complete. The third one, what is called as the transverse. This plane would be extensively utilized when we'll be dealing with the sectional radiography, right? CT scan, MRI, that's where the transverse plane will come into picture, or the axial plane will come into picture. So that is the transverse plane. So this is the transverse plane, right? And it will divide the body into upper part, upper and lower, right? So these are the three planes which you must know with crystal clear understanding. Okay. These words will come again and again, right? I know you are senior enough and you know these words quite well, but just I'm taking it like someone who has just entered into MBBS, so that nothing is left out by chance, right? Sometimes we know that okay, everything is fine, and then during neurology suddenly it is said that okay, it will lead to ipsilateral weakness of the muscle, and suddenly we feel care, what was that ipsilateral, what was that contralateral, right? So that's why we are not leaving anything to chance. Anterior and posterior, easy. Anything which is in front is anterior and posterior, you know. So we'll be writing anterior. Now onwards, we'll be writing anterior like this and posterior like this. Okay? Okay. You know what is superior, right? Superior is above, inferior is below. So that is also well known. In case if anyone has got any doubt, right, send a mail, right? So today, in benefit of all everyone, I'm taking these things bit fast. Wait, I say why right now, please don't compare, right? Every faculty is respectable, right? So please don't compare, right? If you like something, right, I'm happy that yes, you like it, right? But please don't compare, right? Okay, so moving on to the medial and lateral, right? This is very important. So anyone who is in first SEM, please understand this, because this will keep on coming again and again. And then during our discussions on the real anatomy topics, right, this medial lateral will come so frequently. So here is the body, right? So the line which is in passing through absolute center, right, it is, right, midline, right? This is midline. So now if I am drawing two structures, one here, let me name this thing as 1 and this thing as 2, right? So which structure is near to the midline? It is 1, and this is away from the midline. So medial and lateral, they are relative term. Remember, they are relative term. So what statement I would write? I would write that structure 1 is medial to structure 2. Got it? So it tells that structure 1 structure 1 is more near to the midline as compared to 2. So when there will be extensive structures, so it is like what are the medial relation, what are the lateral relations. So it means whatever the structure which we are talking about, let's say here is a structure, right? Here is a structure. Let's name it as X. So what are the structures which are medial to X? Well, medial to X is 1, right? 1 is medial to X. And what are the structures which are lateral to X? Well, they are 2. So, right, this is medial, 1 is medial to 2, right? 1 is medial to 2, very right. Similarly, there is like proximal or distal, right? Remember it in Hindi. Proximal means P for P, that is pass, and this is dur, right? D for D. So proximal is something which is near, distal is something which is far, right? So simple as that. So that's the reason when in hand we say that this is our proximal phalanx, right? This is our distal phalanx. Distal is this is the at far distance, and this is the proximal which is nearer. So obviously middle one is middle one, right? Then there would be like superficial and deep, right? They are self-explanatory, right? Superficial and deep structures, they are quite self-explanatory. Now when it comes to embryology, right? When it comes to embryology, we'll be discussing during this week only, right? During this week, right from the fertilization to all the way up to 8th week development. My wish is that we take one or two sessions, whatever it is, however it is comfortable. We take this also. Now, advantage of this would be that whenever we'll be talking about any of the system, if you know how it develops, it will be, you'll find it so easy to understand that their relations. You'll find it so easy to understand about its nerve supply, blood supply, why, and you don't have to cram anything, right? So that's how we'll be planning. Yeah, medial, which is near to the midline, lateral is away from the midline. Perfect. Pass and dur. True. Okay. So in embryology, we'll be using some other words, right? And say that is from, yes, that is Terminologia Embryologia, right? TE, right? They have defined these words. So over there, we'll be using, say, dorsal and ventral. This dorsal and ventral, why? Because the baby is in the womb, right? Baby is in the uterus. Now when it is rotating, so will you be describing that rotation with respect to mother? No, you'll be describing it with respect to that particular fetus who is developing, right? So that's why the dorsal and ventral. So whenever we say dorsal, it is like we are dealing with the posterior part, and whenever it comes to ventral, it is the anterior part, right? More when we'll be discussing the embryology, but yes, right from the fertilization, and so much so that I wish that I'll tell you something about all the types of inheritance and some of the clinical aspects also, right? So we'll be doing it. Okay, then caudal, right? This is caudal and cranial. Caudal means anything which is towards the tail end, right? Tail end. And cranial is head end. So this will give you that orientation. Cranial will also be called as cephalad, right? Cephalic towards the head, right? For the hands, this surface is palmar, right? Similarly for the foot, that sole is plantar, right? So we'll be using the words palmar and plantar, right? With respect to hand and feet, right? It is obvious. Okay. Then another important part, radial and ulnar side, right? And at the same time, in lower limb, tibial and fibular. Now in both these cases, radial bone is a bigger bone, tibial bone is a bigger bone. Which side it is? wherever you have got the thumb, that is wherever you have got the bigger digit, right? So thumb is over here, so obviously my this side is the radial side. How? We take the radial pulse, right? And in case of foot, right, in case of lower limb, that tibial bone is inside, right? So that tibial bone is medial, right? While in case of upper limb, the bigger bone radius is lateral. Am I right? So over here, just to remember, right, it is the thumb side, and over here it would be the big toe side. Good, right? So just to remember, idea is to put minimum load on our brain, right? So that we just watch it and we understand it. The next is what we were telling about was laterality, right? That is what is called as the laterality. We are discussing this so that then as we proceed, we'll start using this language, right? So exactly, the initially we learn A to Z, then we start making the words, then we start making those sentences, right? Then we start making those compound sentences, then we start writing those paragraphs, right? And one day we find that we are speaking so comfortably, right? We never knew that we traveled this much. Same thing would happen even in this case. This is like a new language, right? So gradually we'll start using only this language, right? Okay. So in case of laterality, right, let's see it like this. Whenever things are only on one side, so you call it unilateral. है ना? This is unilateral. Now let's say if it is happening on both the sides, so here also and here also. So in that case, we call it bilateral. True? We call it bilateral. And just a minute. Let me set some good colors. Okay, just a minute. Just a minute. Okay. Now it would be good. So unilateral, bilateral, and if something is happening like this, say on the same side, so then it is called as ipsilateral. Ipsilateral, right? So same side. When we'll be learning neurology, so at that time, let's say if there is right upper limb and left upper limb are involved, so it is what is called as the ipsilateral involvement. Correct? Ipsilateral involvement, both on the same side. And then if there is anything like this here and here, right? It's like right upper limb and the left lower limb. So then such things they are called as the contralateral. They are called as the contralateral. Right? This is in cross, right? I'll just write cross so that way we remember. So this is what is called as the laterality, and we'll keep on utilizing it again and again, right? Okay. Now comes some very important movements. Movements which are easy, right? We'll go for that bit fast. And I'll write, as you see, I'm writing only in the form of keywords. There won't be anything running long sentences. So some movements which everyone must know, one which is called as the flexion, right? The opposite movement is extension. Flexion and extension will be used again so many times because the muscles, they are divided into that compartment. So this is when there is decrease in the angle, right? Decrease in the angle. So that is what is called as the flexion, right? So there is decrease in angle. So that is what goes for flexion, right? When straightening it, so it means there is increase in angle, so that is extension. Think it this way, right? The muscles which will be contracting from here, they will straighten the arm. The muscles which will be contracting from here, they'll be flexing the arm. So that's why they will be called as flexors and extensor group. And whenever all these muscles, they work in tune with each other. So if the hand is exactly like this, it means flexor and extensor, both the groups, they are balancing each other, right? So in case if there is problem in any of the one group, if one group is not working, immediately second group, which is normal, but relatively it will overact and the hand will remain into that extensor position only, right? So something what you saw in upper limb, right? Why it's like Orb's palsy, etc. Okay. Okay. Then the second movement, abduction. Abduction and adduction. Adduction. So adduction means to add. So when you say adduction, it means you are adding to the body. That means that part is coming near, right? So that is what is called as adduction. Adduction means coming near. Abduction means to go far. Abduct means to leave someone. That is called as abduct, right? So that abduct is to go away, and this is adduction, right, which comes near, right? So I'm just writing to add, right, to add, so it makes sense. Then pronation and supination. Pronation and supination, remember it like kings pronate, beggars supine, right? Kings pronate. So just write this, kings pronate, right? All those muscles, yeah, moving away from the body, that's right. So kings pronate, right? So when they give, you want to give something to someone, so that is pronation. So this movement is pronation. So when you will see that, okay, this is pronation, that's where these two bones, they are overlapping each other. So there has to be two bones. Yes, there are two muscles, right? So there would be like pronator muscles, which will be acting at both the ends. When they contract, they overlap, right? They overlap. So that's pronation. And when you go back, right, it is, right, supination. Supination. So that is supination. Circumduction is combination, right? Circumduction is like, say, in exercise, right? For the warm up, what do you say? You stand on both of your feet parallel, and then you rotate your entire trunk, right? You rotate your entire trunk. That's like circumduction, right? Circumduction. So in that, you'll do flexion, then you will rotate on one side, then it is backside extension, then once again over here. So that's why when you rotate, it is like a combination movement, right? So that's why it is like combination, right? It is combination of movements. Okay. Ulnar and deviation. This is ulnar or radial deviation. So obviously we are dealing with wrist, right? So make simple that, say, this is the radial side, this is ulnar side. On this side, this is ulnar deviation, and this side, it is the radial deviation, right? So ulnar, it is when the deviation is on the inside, and radial when the deviation is on the outside, right? Similarly, name itself is telling elevation and depression, right? Elevation and depression. So you know it, right? So shoulder, elevation and depression, right? Very important. And finally, inversion, inversion and eversion. So in case of foot, right? In case of foot, so when it is pointing towards inside or it is pointing towards outside, inversion and eversion. And then there is one more, right? This, right? what you are counting, right? So that is what is called as the opposition. Opposition. So these names, right? These names will be giving you even that idea, the name of those muscles, right? So that is what is called as the opposition. Now starts that our body, right? Our body is divided into two very fine parts, right? Dorsal and ventral, right? Dorsal and ventral. And as we said, the dorsal was posterior, right? And ventral was anterior. Dorsal, these are the body cavities, right? Body cavities. At times, it's like, what is that mediastinum, right? There is so much of confusion. Circumduction is just combination, right? Say, for example, when we are moving our hand like this. So actually what we are doing, flexing, then it goes for the radial deviation, then this is extension, then this is ulnar deviation. So combination of these four, right? This is circumduction. So same way circumduction can be done at shoulder level, it can be done at say waist level, everywhere, right? When the combination of movements. In fact, these combination of movements, as I said, that every doctor should be absolutely fit, right? Because when you are learning things in this much detail, it means you can know very well how to take proper care of your body, right? Opposition is when you are counting, right? When the thumb, say, it is touching, you are touching all the digits like this, right? When you are counting. So this is what is called as the opposition, right? Yeah, make a big O by your hand. Yes, that is right. That is circumduction. Yes. Okay. So coming back to these body cavities, dorsal and ventral. See, these dorsal, here is our head, right? So this is what is called as the cranial cavity. Cranial. So that's why this is called as the cranium, right? In which there is brain. But when you look at the base of the skull, there is foramen magnum, right? Foramen magnum. Magnum means something which is big. Foramen is that hole, and through which the spine is coming out, right? So that means that spine is coming out. So that is cranium, and this is the vertebral cavity, right? This is very small. So these are the dorsal one, posterior one. But what about the ventral, anterior? Everything is over here only. Right? Let's divide it into two parts. One what is called as the thoracic, and second is abdominal. In fact, abdopelvis, but we'll come to that. Right? So right now I'm just writing abdominal. Okay? Now in thoracic, things are easy, but there comes one word, mediastinum. Now, mediastinum, the moment it comes, it starts creating confusion, right? And at times it takes some time to understand. I'm trying to make just two figures and you will understand what it is. See, in thorax, here is one lung, here is another lung, and this would be the area, right? This would be the area for heart, right? See, drawn with pink. Okay, so here is a right lung, this one is left lung, and that one is heart. What mediastinum is? Between these two lungs, right, there is a space, and that space is divided, and it is said, it is given the name mediastinum. Mediastinum means something which is in middle. It is in middle, right? So how do we see this thing? See, the mediastinum is divided into two parts, right? I'll show you both. There is one superior mediastinum and second one is inferior mediastinum. Okay. So when you want to watch superior inferior, so you have to watch from front. So here this is superior mediastinum. How do we differentiate? We differentiate it that way, that between these two lungs and above the heart, right, whatever we are getting this over here, this is superior mediastinum. But one important point, say if I draw like this, right, these are the lungs, right lung and left lung. And so this is right lung, this is left lung, and this one is heart. So then this is superior mediastinum, right? Superior mediastinum. And for this superior mediastinum, and below would be the inferior mediastinum, this junction is called as the angle of Louis. And you can feel that angle even in yourself. The manubrium and the sternum, manubriosternal ridge. So just on your chest, when you feel that sharp ridge, right? That sharp ridge is what is this? Is the manubrium. Sorry, this is the manubrium, and that's the sternum. This is the ridge which we are talking about, because it is so prominent and it is the level where the second rib would be connected. So if you know this ridge, you'll know that, okay, this is second rib, and then accordingly you can calculate, and it will carry a tremendous weightage when you'll be putting those electrodes in case of ECG, right? Because there, I'll just say put it into this, say, middle clavicular line on say fourth intercostal space. But then how to calculate? This would be the clue. This is where you will calculate. So in thorax, we'll be studying about it in more detail. But one important point is that this angle of Louis, that is manubrio sternal angle, right? This one is called as manubrium, this one is called as sternum. Manubriosternal angle or manubriosternal joint is also the junction where it differentiates superior mediastinum and the inferior mediastinum. So this is that level, right? That is that level, this one. So it is that level where it will divide into superior and inferior mediastinum. Yeah, structure is like a tie. Okay. Now the next point. So superior mediastinum is completely clear. That is above the heart, above the level of manubriosternal junction. This is the area that is superior mediastinum, right? It is easy to understand. But now comes the inferior mediastinum, where exactly it is. For inferior mediastinum, right, you have to watch it in lateral plane. So from side, right? You have to watch it from the side. When you are watching it from the side, right? So here is the heart, right? Let's draw with pink, right? So here is the heart. And where was the superior mediastinum? Well, this is the superior mediastinum. Okay. Now, anything below, it is inferior mediastinum, sure. But then this inferior mediastinum is divided into this part, something which is in front of the heart. Consider this is anterior. So this portion, right, this green portion is anterior inferior mediastinum. Make sense? Right? And so this is posterior side, correct? So behind the heart, what structures, etc., everything would come. Right now we are just understanding these cavities. So over here, this would be, it would be the posterior part of inferior mediastinum, right? Inferior mediastinum. So that makes a good sense. And in between, well, only one name. It would be the middle part of inferior mediastinum. That's it. Mediastinum is this easy. So, and this level is angle of Louis or the manubriosternal angle. Manubriosternal angle. Fine. So this is about the cavity. Rest of the things, they are now very easy. Nothing much, right? This would be the abdominal cavity, and in between abdominal cavity and the thoracic cavity, yes, there is diaphragm, and there is pelvic cavity, right? In pelvis, all the reproductive organs, right, they are arranged. So this is how the entire body is divided into various cavities. These cavities, they are completely different and separated from each other, right? So we'll see that whenever there is diaphragm, so we'll be discussing at length in diaphragm that how many, say, foramens are there, from where the structures will be going from above to below, right? All right. So this is about the basic cavities. The lungs, they will be all covered by something what's called as the pleura, right? Pleura. So in pleura means it is just a cover. It's just a cover for the lungs, and it will be having two parts: visceral pleura and the parietal pleura. Do remember this parietal and visceral. Let me write visceral bit properly. Visceral. Viscera means organ. So visceral pleura, it is near the organ. Near the organ. So there would be pericardium. Pericardium means a layer, something which is covering the heart. So there will be visceral and the parietal part. So same way over here, visceral and parietal pleura, and in between space between these two, that is the pleural cavity. Right? That would be the pleural cavity. And it is in this pleural cavity there is negative pressure, and that's the reason how we really breathe, right? How we really breathe. Because that would be sucking the air, and so when we take deep breathe, that inspiration is active process, but when we do expiration, it is a passive process, right? You don't have to use the energy. It automatically releases the air from the mouth, right? Okay, so visceral and parietal pleura. Every topic, every point is so vital. Now, there would be a concept of anatomical variants. Sometimes it becomes very irritable that, okay, these are the relation, but in some cases, this is what really happens, etc. Right? Peritoneum divides pelvic and abdominal cavity. Yes, that's right. You are right. Because there are few structures which will be covered by peritoneum, few structures which will be retroperitoneal, right? So yes, this is like, in fact, it is not the peritoneum. In fact, there is a pelvic diaphragm. There is something called pelvic diaphragm, and then there is a true pelvis and the false pelvis. So those things, they come like that. Okay, so in case of anatomical variants, right, what the importance is that sometimes these are the normal variations. So these normal variations, they should be known to you. So whenever, say, none of the body is like completely, absolutely like a cut to cut a absolute replica. There would be few changes. So when in embryology, as the things develop, it keeps on changing, right? Say for example, say appendix, right? Appendix. So this is like, say, right, that's the stomach, and then this is the duodenum, right? First, second, third, fourth part of duodenum, and then there are all those loops, right? Duodenum, jejunum, ileum, and finally it comes to this point which is called as the cecum, right? Cecum, and it is at this junction there is appendix. Now this appendix, it can be in any of the position, right? There are several positions, but say retrocecal. Now see the name, retro, behind the cecum, right? This is the commonest position. Almost in 70% of the cases, it is like this, right? Or the pelvic position. So in almost say 25% cases, you will find it in this pelvic position. But as a surgeon, if you are handling any of the appendicectomy, so then you need to know about all these position, right? And when you talk about these position, you will be more successful if you have in mind that where can it really be. So I'll show you that how shall we try to remember such things. Say if I draw it like this, easiest method to remember, right? Just draw like this. And cecum, right? This was cecum. This is what is called as the cecum. Say this is cecum. And we are interested in this green color appendix, right? So where this appendix can be. So everything will be with respect to this cecum. Cecum, right? And when we talk about this, this is what 12 o'clock position, right? 12 o'clock. So here the cecum will be behind. So here the appendix will be behind the cecum. So we'll call it retrocecal, behind the cecum, right? Let's say this is 1 o'clock position, right? This is say 2 o'clock position. This is 3 o'clock position. This one would be say roughly 4 o'clock, right? Say it has to be slight like that, but it's okay. 5, 6, these are the positions, right? There'll be one more position like this, say at 11 o'clock. All these positions, they will be having some name, right? Over here, it would be called as the paracecal, right? Paracecal. And I show you one very easy method, that if you draw a line like this, right? Like a line like this, like this. The structures which are on this side, they all will be posterior. That means there the appendix will go underneath the cecum, and those who are on this side of the line, so these are all anterior, right? So then there will be, let's say over here it would be called as the promontoric position of the cecum, or subileal, right? Or this is what is called as the pelvic position. So these are various names, but the commonest retrocecal and the pelvic. Then this promontoric, etc., they are 0.5% or 1%, very less. Here the way it is like obturator position, right? So because just underneath over there is an obturator foramen. So obturator. So that's how the names are. But these are all in say 2%, 1%, that much. Main what you need to remember, one, pelvic position, and second is retrocecal. So this is just an example that how things can really be, right? How things can really be with the normal variations. Okay. We are taking the reference as cecum, right? We are taking the reference as this area. This is what is called as the cecum. Then as we'll proceed, this will be what is called as the ascending colon, right? Then it will go like this. So we'll call it a transverse colon. Then it will go down. So we'll call it a descending colon. Then it will go like this. So we'll call it sigmoid colon, right? So that is how it proceeds. But right now our area of focus is this with respect to cecum. That's why, see, look at the name, right? Retrocecal, right? This is towards pelvis. So that's why it is called as pelvic, right? Okay. Now, as I said, that our concept is, this entire idea for this series is to prepare you so thoroughly for any of the new topic, right? This is just like us now, what we are about to take is like a small trailer, right? Say the bone. So bone will be doing what? Say skeletal system, right? What we call this thing to a skeletal system, what is skeletal system? It's like all bones plus the tissues connecting them, right? So that is what is called as the skeletal system. In adults, there'll be like 206 bones. In the newborn, there'll be 300 bones, right? Because they are separate. Then gradually they'll keep on joining, right? So in case of bone, this bone is as such, can we call it a connective tissue? Yes, it is a connective tissue, and it is that connective tissue which is rigid, right? Which is rigid, which is tough. For first sem, right? What are the function of bones, right? So regarding the functions, so one, that it provides support. Yes, it gives that support. It gives mobility or the movement, right? So mobility or the movement is possible because of bones. Very true. Still anything more? Well, we say that they store calcium, right? They store minerals. So they store minerals, okay, right? Say for example, calcium, phosphate, etc. But very important function is that hemopoiesis, right? It is called as hemopoiesis. Hemopoiesis is nothing but production of RBC, WBC, right? So they produce blood cells, RBC, WBC. Right? So these bones, though they are lightweight, but they are very strong, right? They are pretty strong. Para and pelvic in the diagram. Okay. This is para. 11 o'clock is para. And 5 o'clock, 4 o'clock to 5 o'clock is pelvic. Okay. Para is 11 o'clock. So this is hemopoiesis, RBC, WBC. Now see, when we talk about bones, right? Let's see that bones are strong. Why they are strong? Because if we know this, immediately we can, today only we can learn one disease, right? In which, what if we make those structures weak? So in that case, the entire problem would be with the formation of the weakness of the bones, right? So here bones are strong because of their matrix, right? It is called as the matrix. What is that? This is like a meshwork, right? It's like those meshwork. Meshwork is this, that those tissues, they are arranged like this, so it gives strong support, right? So that's what is called as the meshwork. Now, whenever we want to deal with any of the bony pathology, so we need to know about bone cells first, right? Actually, they are so easy. Bone is not a dead structure, right? It is very active. In fact, it is very active metabolically, right? When we say it is active metabolically, so we need to talk about these three types of cell. Now see, wherever the word comes sites, wherever the word comes blast, and wherever the word comes clast, right? For bone, it would be like osteocytes, osteoblast, and the osteoclast. Right? As we said, this is the active system. So whenever the osteocyte, what's the function of osteocytes? Cytes means those cells. So they will be doing the work of maintenance. Maintenance. Right? They will neither decrease nor increase, nothing. They are for maintenance. Osteoblast, they will lead to formation. Right? They will lead to formation of bone. And osteoclast, that will lead to destruction. I'm using bit harsh word destruction, but as such it is called as the resorption, because see, layer by layer things are developing. So one layer is resorbed, new layers are forming, but I'm writing it so that it is crystal clear. Osteocytes maintenance, blast is formation, clast is destruction, right? So these three. Now with reference to this, let's see what really happens in when a bone is getting formed. Now this is like a such a stupid thing. Means osteoblast works something like, have you seen that movie in which the Anarkali was within the walls, right? Here exactly, here the Anarkali will be creating the walls by herself, right? See what happens. So here are the osteoblasts, right? Osteoblasts, they are doing what? See, we just saw formation. ठीक? So they will start forming. What will they do? They'll say, let's create those fibers, right? So these fibers, they are so important, right? They are the fibers. So these fibers, they are loose, they are soft, right? Not that harsh, but it is making the framework. So first thing, 1 2 clock means this is just like a position, right? 1 or 2, these are the positions. These are the positions with reference to, as in the anatomical position, right? Anyway, say don't worry much about, and because in appendicitis, when we'll be discussing appendix, these things will be coming in tremendous depth. So right now, just remember it, that if this is the cecum, and if the appendix is like this, just underneath like this, right? It is just underneath. So that is how the retrocecal, right? So that's how it goes to that 12 o'clock position. If the appendix is like this, so it is like a pelvic position. So that's how the positions they are decided. Okay, this is very interesting. So first, collagen fibers, right? These are the collagen fibers. So these collagen fibers, they will create the framework, right? They will create the framework. Then these osteoblasts, they are so intelligent, they say, let's deposit calcium into that, right? So this becomes the second spot, that deposit calcium phosphate. Right? So here now the calcium phosphate has been deposited. Phosphate, still soft, right? Even when it is calcium is deposited, it is still soft. But then comes those hydroxide and bicarb ions. So when they come, right, let's say this is step 3, right? Hydroxide and bicarbs. So these are the ions. So they come and they harden it, right? They harden it. Now it is the real tough bone. So this is like a new bone, right? This is like a new bone. New bone is formed. So this new bone, we'll call it osteoid. This is what is called as the osteoid. But what happened in this just a minute. See, don't worry about this appendix part. Now focus on this, right? I'll write in detail into the chat box. So this is osteoid. Now what happens to this osteoblast, right? It is trapped, right? This osteoblast, those which were, they are now trapped. So trapped osteoblast Now what will they do? Just can't do anything. So they are now called as osteocyte. So their function would be just the maintenance. That would be the function. They will just maintain, right? So that would be the osteocyte. Now there would be few cells which will be on the surface also, right? So they will be making the lining of the bone, those few cells. Okay, so now when it comes to osteocytes, so these osteocytes, they are nothing but trapped osteoblast, right? These are the trapped osteoblasts. Now these trapped osteoblasts, they will start, because now they are trapped, right? So here is the, that was the osteoblast, it is trapped, and it is trapped and there is a space, so it is called as the lacunae. And there will be so many other osteoblasts, so they say let's talk with each other. So here is a, right, here is another osteoblast which is trapped, so they make the tunnels between them, and these tunnels, they are called as canals, and because they are very small, so they are called as canaliculi. Canaliculi. Now when you will see the figure, right, we'll be watching it as we'll be discussing histology, but in simple words what you have learnt is the Haversian system. So in bone there would be Haversian system. So in that case you'll see those lacunae, you'll see osteoblast, and then there'll be canaliculi. So collectively this is how the entire meshwork is formed. It makes the bone light, but at the same time, because of those deposits, it becomes much more powerful, right? Stronger. Okay. Finally the part is osteoclast. So osteoclast is for destruction, right? Lacunae means space, right? Lacunae is space. This space, it is called as this space, blank space, right? That is what is called as the lacunae. Osteoblast means who is formation, those who are forming the bone, right? So this is the first step. The collagen fibers, they will lay all those collagen fibers, right? So that will make just a frame. Once the frame is prepared, it will deposit this calcium phosphate, right? And then this calcium phosphate is hardened by hydroxide and bicarb ions. So 0.1, 0.2, 0.3, finally the bone is formed, and this new bone is osteoid. So that is what has been formed by osteoblasts. But now they are trapped, right? They are trapped inside the own walls. So they are called as osteocyte. And these osteocyte, so basically this entire thing is osteocyte, right? This entire thing is osteocyte. They develop tunnels between them, and that is what is called as the canaliculi, right? Yeah, that is what is called as the canaliculi. It means they will be communicating with each other, right? Okay, good. Now comes the destructive part, osteoclast. Osteoclast means they will break down. They will break down what? They will break down the old layers which you want to remove, and the new bone keeps on forming. That's how the bone becomes bigger, bigger, bigger. This is what is called as the bone remodeling, right? That is what is called as the bone remodeling, and it is called as the, this portion in which the bone is resorbed, it is called as the bone resorption. Bone resorption. So here the bone is absorbed, and that's how the new layers, they keep on coming, right? It has got also what is called as the phagocytic like mechanism, right? I always say, if you know that Pac-Man, right? That Pac-Man, right? If you have not played that game, right? That right? That's how that keeps on gobbling, right? So that game, right? Pac-Man, in fact, say they are like phagocytes, right? They keep on moving and eating those dots. So So these are the osteoclast. Their function would be the removal. Now comes the interesting part. So these were the cells, but then there is something what is called as the extracellular matrix, right? What extracellular matrix is, that these are the cells, and in between there is a substance which is holding everything. Divide it into two parts. One, organic. Organic means what? Organic means something which your body is producing. So that is by human body, right? Human body. So when this is getting produced, almost 90 to 95%. And what it is producing? It is producing this collagen, right? Collagen. This is the collagen which is giving the tensile strength, right? Tensile strength. The ability to generate that tension, the ability to generate this entire unit, keeping it as one. And then second is that inorganic, right? Inorganic. So obviously this inorganic is just the reverse. So it is like chemicals, those chemicals which are needed. And in that, the most important, what we just saw, right? Hydroxyapatite, right? And the calcium phosphate, right? Those calcium phosphate, those who are making the bones stronger, etc. Right? So these are the things which we need, and they will be giving compressive strength. They will be giving compressive strength. So when the pressure is put, still your bone sustains, and when you pull it, still your bone sustains. So it is the combination of this collagen as well as, right? It is combination of this collagen and the combination of all those chemicals which are giving compressive strength and the tensile strength. That's how the entire bone is really so powerful, right? Now going into slightly more detail. This is something like for seniors, right? But well, it is not that complicated. Alkaline phosphatase, right? Alkaline phosphatase. This is a lab test. This is a lab test which is so important, right? It is done. And many of the diagnoses which are based on this alkaline phosphatase. What's the normal level? Right? It is always measured in IU, international unit, right? So if 44 to about say 147 IU, that is international unit per liter, right? This is the normal level. Now, I'll write it like BAP. What is BAP? It is bone. In fact, it is bone related alkaline phosphate, but I'm writing bone alkaline phosphatase. Now, when this level is increased, it is important, right? It is important. So we need to know that why should we go for, because in clinics, you must have seen so many times alkaline phosphatase, right? Very routinely ordered for some specific conditions like metastasis, right? So this is added. So let's understand that why are we, and we know the reason. We just talked about that it is the osteoblast, right? Osteoblast. What osteoblast is doing? Osteoblast is leading to formation, true, right? So when there is increased osteoblastic activity, so it means more and more number of osteoblasts they are working, right? When they are working exactly on this surface of osteoblast, here is the osteoblast. On the surface of osteoblast, there is presence of this BAP, right? So when there are more osteoblasts, obviously there will be more concentration of bone alkaline phosphatase. So there will be increase in bone specific alkaline phosphatase. So that's how you get the idea that if the alkaline phosphatase is high, it means there is increased osteoblast activity. Now this osteoblast activity, it should not be beyond certain level, because in that case it means that there is total disruption. There is absolutely a bad balance, right? Because in our body, as the bones are in, say, forming, they are becoming stronger, bigger. So it means both the plastic and the clastic, that is the formation and destruction, they both are going parallelly in sync with each other. So this BAP, practically what it is doing, right, it is leading to, it acts like a catalyst, right, it acts like a catalyst. So it leads to hydrolysis, right? It leads to some hydrolysis of certain minerals, but in other words, there is finally inorganic phosphate which is formed, and it is this phosphate which is used for bone formation, right, or I should say bone remineralization, right? You are adding some minerals to the bone which is good for the bone, right? This is normal, this is the normal activity. Yeah, yeah, bone is light because of lacuna, that's right. Yeah, that's right. So it happens like whenever there is increased alkaline phosphate, right? There are some classical conditions. First thing, you need that is what is called as the Paget's disease. Paget's disease. Second, very common, the bone metastasis. Now let's talk about Paget's disease in bit more detail, because this is the only thing which you need to know, right? Then later on, as we'll proceed, we'll be going for the differential diagnosis. Then we'll watch the X-rays also at a later stage, right? But you should be having the idea that what happens in Paget's disease. Say in Paget's disease, so the normal remodeling, when we say normal remodeling of bone, what really happens? Right? There is a formation, right? And there is destruction. And we call it resorption. Resorption, right? That is what is going on in balance, right? It is going on in balance. In Paget's disease, this balance is out, right? This balance is bad. It is disturbed. So the new bone which is formed, right? This new bone, it has got no enough time to develop it properly. So that's why there would be abnormal shapes, right? The bones would be abnormal shaped. Second, it would be weak. And because the deposition was not done properly, so that's why they can break easily. So that means they will be brittle. Now you know that what is responsible to make the bone strong. Sorry, to make the bone strong, deposition of those ions, right? So when those ions, they are not getting deposited, when the remodeling is not done properly, so that's why the bone are bound to remain weak. And when they are weak, so it means it would lead to what? Fracture, right? So that is what leads to fracture, right? These are like, fractures are so common. If fracture is not happening, at least pain, yes, that is what really happens. Which organs they are commonly, which areas they are commonly affected? Pelvis. Why pelvis? Weight bearing, right? That will carry the weight. Skull is affected. Why? Because skull bones, they are like thin plates. Thin plates. So very commonly affected. Spine, again, it is taking care of the weight. Legs, right? These are commonly affected, right? And that's the reason that when such person, they will walk with bent feet, right? The bones are not strong enough, so that's why there would be the deformity. And the Paget's disease, its technical name becomes osteitis deformans. It means deformity of bones. That's it, right? And what are the causes? That when we talk about that, why it should occur? One is genetics. Luckily, in India, it is not that common, right? Relatively, as compared to it is common in some countries like USA, then Europe, Australia, right? That is where it is much common. Say in India or Japan, right, or China, it is not that common. Age is a factor, right? This is the reason that why nutrition is so important, because any of the deficit can be playing a major role, right? And when I say that how to avoid it, one is your diet, right, in which calcium and the vitamin D, they will be playing a major role. And still more important, right, it is the exercise, right? It is the exercise, and that should also be in two parts. One, the exercise which is keeping your skeletal health very good, right? Skeletal health. And second, exercise which is giving your joints the good mobility. So that's why one would be the endurance training, that is your ability to run for long distance, and second is the strength training, that is for the short burst. It's like, say, short burst 100 or 200 meters and you run at a very high speed, right? Similarly, weight bearing, compound exercises, etc., they all are of tremendous importance. But this is the reason that you see everywhere it is revolving around those osteoblasts only. From there we detected. So in the diagnosis, right, first thing, it would be the history. The patient is classically, right, complaining of joint pain, right? Those joint pains, and they're continuous. You do whatever, it keeps on giving pain. Then you go for lab test, right? Alkaline phosphatase, it is high. You go for x-rays, right? Simple plain x-ray, right? And in that you will see that yes, multiple signs are there, right? When we'll be discussing Paget's disease radiology, right, there are, yeah, there are some very interesting Mickey Mouse sign, etc., right? There are Chanter sign, so many signs are there. But and then the bone scan. So this much will take you to the level that yes, what exactly the problem is, right? And say if you really want to say improve the bone density, right? So this Rx, when we write, it is like a treatment, right? So let's say this is tablet alendronic acid, right? Osteophos, or so many names are there, but this is what is called as the alendronic acid. Now this is a tablet, right, which is like 35 to say 70 milligram per week. It is to be given only 1 week, right? So this is in the form of tablet. And if you give vitamin D and calcium along with it, this is one of the very fine thing against Paget's and osteoporosis, right? So for osteoporosis, which is common in India, right? Osteoporosis, especially females, and or say Paget's disease, in both these cases, right, this is very effective. But once you start the treatment, it is advisable that you should continue it for say 6 months, and after that you review, and it can be continued till almost 1 year, right? And effect would be dramatic, right? You'll see a marked improvement. Okay, so this was just that when we talk about osteoblast, right? How important and how nice things are, right? With respect to when we try to understand any of the disease. Okay, we do have some time, right? Say one concept is like say bone marrow, right? Many times this thing would come, bone marrow. So where is this bone marrow? Now see, in bones there are two types of bones, right? One, like those long bones, right? Those long bones. And in long bones, the outer is cortex, the shaft, right? This shaft is outer is cortex, inner is medulla, right? This is medulla or the medullary cavity. this is medullary cavity. Bas, so this is where this bone marrow is, right? That bone marrow is in this, and these are long bones. And then there are, yeah, and then there are some what is called as the spongy bones. So these spongy bones, say end of the long bone is also a spongy bone, right? Cranium, then say sternum, all those bones which are with plates, right? Thin plates. So spongy bone, it is also called as the trabecular, right? These are all the names of that spongy bone. So trabecular bone. And if I say that in case of medullary, in case of long bone, there is Haversian system. So now you know what Haversian system is. Haversian system in which there will be lacunae, in which there will be canaliculae, there will be formation of that entire meshwork. In case of spongy bone, no, there is no Haversian systems, right? These are like plates, right? They are also called as the cancellous bone. Same thing, right? These are just the name, but the important point is that they, I'll change the color, they consist of plates, right? They consist of those plates. So that's where these spongy bones are. So over here, I'll say like this, Haversian system, and we'll just cross it. It means in spongy bones there is no Haversian system, right? So when we talk about this bone marrow, this is where you get it, long bones and the spongy bones, right? So this bone marrow, let's say it is like this. One is the red bone marrow and second one is the yellow bone marrow. Why red? Because it is vascular. Why yellow? It is definitely not that vascular, right? This will be yellow. Yellow means it is fat. It like at this point it would be adipose tissue, right? Fat tissue. So yes, it makes much obvious that this will be something which will be responsible for blood formation. True? So that is the red bone marrow. And because blood is getting formed at this point, right? All those cells they are getting. So obviously it's not like just press of a button and those cells they appear fully matured. No, they are like all those at various stages. So you will find that cells at various stage of development, right? Makes sense? Various stages of development because they are developing and everything is in the process, right? So at birth, right? So at birth, everything, all sites, they are red bone marrow. All sites, they are red bone marrow. Then as the person say reaches to adulthood, right? So when he is adult, so at that point those sites, right, gradually they got decreased, right? That classically that long bone, right? In long bone, that medullary cavity, right? Medullary cavity which was in shaft, right? Which was in shaft, from red it gets converted to yellow. So now it is no more forming anything. So what about say in adults, where exactly the blood would be formed? At cancellous bones, right? And we just said that these cancellous or the trabecular or the spongy, same name, right? That is where it is at say these long bones but at their end, right? So that is where it formed. Then all the bones which are flat. So sternum is a flat bone, and that's the reason that in adults, in case if you want to go for any of the bone marrow aspiration, you will do it from sternum, right? Then ribs, they are also flat bones, true. Skull bones, right? They are like there is diploid. Diploid means there is outer table, inner table, and in between there are spaces, right? So these are like skull bones. They are as if there are sandwich of those two layers, right? Skull bones. Then vertebra. right? That is where the hemopoiesis will be going on. And don't forget the iliac crest. Again, it is like a flat bone. Iliac crest, right? Those hip joints, right? Those hip joints. So iliac crest, right? Ilium, ischium, and pubis, right? Collectively, they make that entire hip bone, right? Ilium, ischium, and pubis, combination of those three bones. So these are the areas which are basically all cancellous, right? So that is where it forms. And what about, say, that yellow? Yellow is, it's like adipose tissue. But interesting thing is that in case of critical conditions, right? So this is like they are acting like a backup. So in critical condition, when there is severe bleeding, right? When there is severe bleeding or there is hypoxia. So in such cases, they can get converted to red bone marrow and they can be operational, right? When they are actually, in case if they are needed, right? So that's the clinically what we were talking about, that in clinically, in case of adult, yes, sternum is the site, sternum is the way to go for bone marrow aspiration, right? Bone marrow aspiration. So bone marrow aspiration. But in case of children, never even attempt that, because their sternum, that is very thin. And when you put a wide bore needle, there are chances that in case if it goes down straight away, it will be affecting, it will be entering into the heart. So in that case, sternum, no. All right, sternum, no. Where should we go for? Iliac crest, right? In case of children, it has to be iliac crest. In case of adult, it is sternum, right? And as the age increases, right, that is in the old age, or if the person is sedentary, so in that case, those red bone marrow, they got converted into something which is very interesting. It goes into what's called as the gelatinous marrow, completely non-functional, right? So this is something like a jelly-like substance. Jelly-like substance. So that's what really happens in case of, say, old age, right? So this was for today. Uh, yeah, that's right. Bone metastasis is definitely associated with the bone cancer, right? Say in carcinoma, there is one what is called as the primary carcinoma site. Primary site is where the actual pathology is. And then metastasis, it is also called as the secondaries, right? Secondaries. It is same as metastasis. That means that primary site is releasing those carcinomatous cells and they are lodging into different areas. And this is very important in staging, because when there is secondary, whenever there are metastases, it spoils the prognosis. That is the chances of recovery. It really spoils the prognosis, right? So that is true. So it is anything else? All right. Exercise morning or evening? Well, ideally, whenever you get the time, right? Yes, you should exercise. And the newer concept is still interesting. It is like, say, if someone is going into gym for 2 hours in the morning and then for rest of the day he's just sitting, to know that is not considered as good. Ideally, say every hour, or let's say every 2 hours, right? 1 or let's say 2 hours, even if you walk for say 200 steps, this should be good, right? Because your body is not meant to sit at one position, right? Just keep moving. So that is what is needed. Cancellous means soft, right? That's why say cancellous bone, it is also called as the spongy bone, right? So that means it is soft. Soft because there is no Haversian system. Haversian system is like when they are all interconnected and with those canaliculi all formations. So they are very strong, right? So cancellous means they don't have Haversian system. All right. So now this is always available to you. Okay. For tomorrow, right, in this video only, as such, if you have turned the notifications on, so in that case, so there is no problem. You will, the moment I'll just after a few minutes, I'll be uploading the links for our tomorrow and further sessions. So you'll automatically get the notifications. And say the playlist which I have made is absolute essential, right? That's the playlist which I have made. So absolute essential for anatomy. Then I'll keep on making new playlists so it becomes easy for you to follow, right? In exam we sit for yeah, that's why our exam won't be that long. YouTube gave us a feature to go back for 10 seconds if you miss something. Yeah, well, that is good. That is good. Say sternum, none of the bones, right? Say for example, say iliac crest, that is also not soft, but the inside of it, right? That is really soft. So and it is a relative. You think about the shaft, how strong it is. So this is all relatively. Physiology would be next week. We shall be going for physiology. Right? So that way, as I said, that this is a long procedure, but by the end you will be very happy because we'll be covering every subject. Not today, prepare it nicely because Saturday it would be a nice test, right? Saturday would be a nice test. And actually we'll be planning it in very proper way. So I'll tell you all the rules also on that day. Yes, this would automatically be saved. So the moment I'll click finish and stream, this would be saved and it will be available to you forever, right? Right. So it would be automatically uploaded. So right, that's the thing for today. And thank you so much for a very nice discipline. I am happy. And we meet tomorrow, same time, right? Thank you so much. Study well and good night. Bye bye.